Hello, I'm Stan Papoulis, a survivor user researcher and research fellow at King's College London. And I'm here to talk about our project on the working conditions of the patient public involvement engagement workforce that has been funded by the National Institute for Health Research Applied Research Collaboration South London, and that took place between 2021-23. The embedding of patient and public involvement in all aspects of health research, particularly in applied health research, has been part of the mission of the NIHR from its foundation, in line with a patient-centered turn defining the 1990s policy landscape for the NHS. And here you see a well-known graphic from the founding document of the NIHR, Best Research for Best Health, in 2006. Showing visually how the patients and the public are meant to be at the center of this NHS research organization. And the mission of the NIHR, according to this document, is to place people at the center of a research system that focuses on quality, transparency, and value for money. And PPI has been, from the beginning, a way to show this centering of patients in health research. By 2021, when the next chapter of Best Research for Best Health was published, setting the route for NIHR for the next 10 years, this emphasis on PPI had become more expansive. Now there was talk of community engagement, of co-production, of working in equitable, diverse and inclusive terms, and of inclusive partnerships. This emphasis was highlighted in the next chapter document itself, which suggested that what is needed now is a diverse and inclusive research environment with equitable and close partnerships with communities and groups, including those who had been underserved. And emphasizing that in order to do this, the NIHR needs to work differently and take research closer to people and emphasize the importance of building relationships. Now, as patient public involvement has become more established across health research, so too calls for evidence on its impact have grown. So have the recommendations, the guidelines, the best practice case studies, and of course all manner of toolkits aiming to measure, improve and progress. It is remarkable in this context then that there is a key dimension of PPI that has had much less attention. This is the labour involved in this field. There are neighbouring fields where much more has been written about the labour itself. Public engagement is one example, and also lived experience research, survivor service user researchers and their work. But in the field of PPI itself, there has been comparative silence. Now, there are exceptions. For example, in 2013, in a chapter on the researcher perspective on service user involvement in mental health research, Catherine Pollard and David Evans presented quite a lengthy discussion of this work and its challenges. Pollard and Evans spoke of a tension while doing this work between the quality and efficiency drives, hitting performance milestones, producing high-quality research outputs, and the work needed to establish collaborative relationships with service users and the public. Building such relationships, they argued, takes time. They suggested that this tension can be somewhat released if there is another member of staff, a dedicated workforce, to take care of what they call then the practicalities. Now, over time, and as the infrastructure for PPI grew, a dedicated workforce did also grow and expand with it. In 2015, Involve, the advisory group for patient public involvement in the NIHR, published Going the Extra Mile, a review of the progress on patient public involvement so far. They calculated that up to that point, upwards of 200 staff were employed in PPI lead positions and recommended that this growing workforce be supported and resourced in a stable manner. In the same year, a realist evaluation of PPI activity, funded and published by the NIHR, proposed that a dedicated PPI role was crucial for effectively embedding PPI, but that such roles should be accompanied by a shared responsibility across the teams and also by time to develop relationships. The report study talked about these roles as bridging or boundary spanning roles between two or more worlds, as translators, mediators, facilitators. And report 2 mentioned something of that tension that Pollard and Evans had spoken of PPI takes time and requires continuity, and so it sits uneasily within tight research timelines and short staff contracts. In 2019, the NIHR published on their website a specification of the responsibilities of PPI leads. Here you can see a few. It's not a complete list. This list gives you an idea of some of that work and of how expansive it is. It mixes together quite distinct and specialized roles. For example, there is facilitation, there is strategy building, there is ensuring that involvement is aligned and embeds the guidelines, the standards. It includes roles that are public-facing and roles that are organization and funder-facing. Now, having worked in such roles ourselves, PPI lead roles, Louca-Mai and myself felt that we wanted to surface this labor because we had a hunch that through this surfacing, we could have a better ground-up view of how involvement fits or does not fit within research environments. In other words, to have a better ground-up view of that tension that Pollard and Evans talked about back in 2013. So we did a piece of insider research. Insider research is a methodology where people from within a community do research on the community. For me specifically, as a user survivor researcher, this was an opportunity to apply peer-led, lived experience research principles to a different set of peers, in this case, not mental health service users, but the PPI workforce. So the study started with the question, what is the labor of the PPI workforce? And also, how does this labor fit within the research environments, the research ecologies for health research, specifically focusing on the NIHR, because the NIHR has the most developed infrastructure for PPI. So the study was qualitative with participatory elements in which the participants themselves, the PPI workforce, had a key role in how the next phase of the study went and also in interpreting the findings. We concentrated not only on the NIHR, but specifically on infrastructure grants, because we felt that these represent best the mission, the central mission of the NIHR. Infrastructure grants are sizable parts of the investment of NIHR, and they essentially create platforms to enable research and collaborative undertakings. We used a number of methods, qualitative interviews, focus groups, workshops, and audio diaries. And we deployed reflexive thematic analysis for the findings. So in this presentation, we're going to be talking about findings from the first phase of the study, in which we did 21 semi-structured remote interviews on Zoom. The duration of them was between 60 and 90 minutes. And in the interviews, we used a topic guide, which looked at the nature of the role, the place of the PPI worker in the organization, the relationship between their initial job description when they came onto the role versus their experience of how the role actually was on the ground, their relationships to colleagues, and the challenges of the role. Now, we produced 5 themes in this part of the study, but today we're going to be talking about 3 of these. So the first theme is about the ambiguity of the support role. Now, in theory, there is a clear delineation of different roles within a PPI team. There is the lead or manager, which is a strategic oversight role. There is the coordinator or officer, who is doing a facilitative, more junior role and is public-facing as opposed to organization-facing. And there is also a support or administrative role dealing with what Evans and Pollard called the practicalities, payments and making appointments, finding rooms for sessions, for workshops, for meetings, and so on. However, in reality, on many organizations, people did a bit of everything, working between roles, both outreach, relationship building, and strategy expanding. And a good number of participants said that for at least part of their role, they had to work alone. A very isolated role, one of the participants said. One said, I'm a manager, but I don't have anyone to manage. I guess I manage myself, or I manage the volunteers, that is the public contributors. This was said half jokingly, but what it showed is that a role, managing, which relates to organizing performance in the workplace, was here being extended to describe activities that do not fall under that role. Public contributors are not workers. They're not employees. They cannot be managed. So what does it mean to use a term which is not appropriate to the context? How do you manage public contributors? This became a pattern. Terms used to describe PPI work were not appropriate to the context of that work. They were borrowed from the performance management vocabulary of research delivery and applied in a different field, applied to people who were not part of that ecology, who were not part of that environment, but certainly external to it. Another kind of ambiguity of the support role was in the relationship of the PPI team and the research team, the researchers. So initially, the support role was set up so that the team would support the researchers in their researchers doing undertaking of PPI, so that they would provide advice, they would provide training, resources, and so on. But often what participants told us was happening is that the research team expected that the PPI team would support them by themselves doing PPI, so that they would be relieved of the responsibility to undertake it. In other words, often the presence of a PPI team meant that responsibility for PPI could be outsourced to them, so that the rest of the institution did not, of the team, did not have to engage with that responsibility. Theme number 2 is the excess and visibility of PPI work. Now, in research environments, just as in many other workplaces, there is a lot of invisible labor that is not counted, that is not obvious, such as, for example, administrative labor or the labor of networking. Now, in terms of PPI, our point is that this type of work generates additional invisibility, even more invisible labor than normal. Now, why is this? Well, once PPI becomes embedded with lead roles and a team responsible for these activities, it becomes assimilated to the organizational frameworks. It comes to be perceived as another deliverable. What that means is that researchers can come to expect that PPI can somehow be delivered to fit their deadlines, to emerge just in time, as it were. Often, we were told that researchers would come to the PPI team and say, my bid is the deadline for my bid is in 3 days. I just need some PPIs. That phrase was actually used, some PPIs, to check over my proposal, to look at some of the details to say that it's okay. Is it plain English, for example? This story was repeated again and again. So here, the work needed to build relationships and trust disappears in a kind of black box. Researchers often have little understanding of the kind of frenzy of activity that their demands elicit to actually deliver something in the nick of time. And the point here is that this invisibility was in fact aggravated and intensified through the NIHR requirement for PPI leads, in the way that the NIHR had phrased the requirement that there is a role responsible for PPI. Now, academic leads are senior oversight roles with management responsibilities. When you have costings for a grant, such leads are typically allocated at 5% of full-time equivalent, which comes to just under 2 hours a week. Although more recently, in some grant bids, they can be as high as 10%, half a day. But they're not rarely more than half a day. But a PPI lead is not remotely the same kind of role, both because it's both hands-on and oversight, strategic and frontline, but also because, again, public contributors and underserved communities specifically cannot be managed as though they are staff. So imagine how it works out when, in some cases, PPI leads, as our participant says here, are given even less, a 2% allocation, under 1 hour a week. As the participant says, what do you think I would do in what amounts to 39 hours a year? They wouldn't have a clue. So again, the instruments for accounting for research labor are not fit for the kind of labour that's specific to PPI. And here's the last theme, delivering change without change. So the point here is that PPI staff do not have the authority to push back against institutional structures and routines which may not be fit for PPI, which may be different from or constricting of the time and the routines are required to embed relationships. For example, the best that PPI staff can do is suggest adjustments to those structures and routines. So when it comes to writing PPI into a new grant proposal, for example, PPI staff have to fit into a just-in-time logic, producing plans, smart objectives, and so on within a few days, within a couple of weeks at best. However, embedding PPI, and certainly embedding inclusive PPI, as is increasingly required, cannot be undertaken without considerable institutional change, considerable structural change. Yet, the reporting and performance management systems of these organizations cannot contemplate such change, do not allow space for such change. And yet, PPI staff have to essentially get on with it, as our participant talks about here. I'm not there really to point out any of the issues, I'm there just to get on with it. So they have to get on with it, despite the fact that the it in question, inclusive involvement, requires not getting on. It requires transforming the system. But they have to get on with it, despite the fact that that can happen without a change that they do not have the authority to implement. So to sum up then, we have talked about the invisibility of PPI labour, we've talked about the ambiguity of the support role and the sort of a paradoxical demand to get on with it. So we have, in other words, stated that the invisibility of PPI labour can be exacerbated, made worse, through the very instruments that are deployed to make it visible, to recognise it, to quantify it. They are the requirement for a costed PPI lead, not the same as an academic lead, the expectation that PPI becomes a deliverable, trust, building relationships, and engaging with power dynamics does not fit in that logic. The mandatory inclusion of a PPI section in reports to funder where you have to show that PPI has been delivered. So a lot of those difficulties and challenges disappear. So the PPI workforce are caught in a contradictory demand. They're expected to develop partnerships, increasingly inclusive with underserved communities and so on, which require challenging ways of working, changing ways of working, but they're also expected to get on with it, not challenge ways of working, not change organizational systems, both at the same time. So now, if we remember the place where we started, which is Best Research for Best Health, the next chapter from 2021, remember there is a commitment to create a diverse and inclusive research environment founded on equitable relationships, partnerships with underserved groups and communities, and a recognition that to do that, you need to work differently. You need to prioritize building relationships. Now, the problem is that PPI teams, PPI workers, are expected to deliver the former diverse and inclusive environment, but without having the authority to have an impact on the latter, to develop the different result from the same working relationships, from the same research environments that need to change. And it is this paradox which is where the workforce is caught. And so this study asks, what will it mean to recognize that working differently requires transforming organizational norms and exclusionary structures instead of just getting on with it, instead of remaining with them, because remaining with them can never create an inclusive space of collaboration. In terms of where next, we are using the data from the interviews and the diaries to create a series of vignettes, illustrations or cartoons, which demonstrate aspects of invisibility, aspects of that paradox that is the PPI labor. Here is the some of the consequences of turning PPI into a deliverable, or the researcher expectations that the PPI team will produce a rabbit out of a hat. And we are hoping that these vignettes will help us having these conversations and tracing possible ways forward together. I want to thank Camille Aubry, the brilliant illustrator who is bringing the words of our participants to life, and also the members of the advisory group, Tina Coldham, Mary Newborn, Rachel Matthews, whose support, expertise and warmth made this project a reality. Also, all the generous participants who worked with us over many months. And yeah, I want to leave this open to you. If you have any questions or comments, please do not hesitate to contact us. Thank you very much.